But on the ground, in some localities now, efforts are being made to get in touch with senior citizens through the Resident Welfare Association so that the local authorities have a list of those who should line up, apart from healthcare and frontline workers. It's these senior citizens who will be administered the COVID shot in the first phase of immunization. So I want to give you a sense of the effort that's being made, the real effort that's being made to try and ensure that we have a registry that's ready. Once the shots come in, then we can get the vaccination program actually rolled out. Take a look at this report.
Delhi is gearing up for the vaccination program. A dry run was conducted in the capital to test the delivery system. Around 4.2 million people above the age of 50 have been identified for the first phase of vaccination. The Delhi government has sought help from the various resident welfare associations in the city for the mass vaccination drive. 9 lakh health and frontline workers are amongst those who will get the first jab. Delhi's VASANT Welfare Association is amongst those which has been contacted by the Delhi government to provide data.
The day before yesterday in the evening, we got an advisory from the Delhi government wanting that they're saying they wanted to create a database on 3 lines, 60 and above, 50 to 60, and the third, which they did not mention but which is there in the papers, less than 50 but serious comorbidities. So we are collecting that data.
The RWAs are key to the program since they have ready data of residents who are eligible for the first dose.
Resident Welfare Association, they play a very important role in any of the healthcare program, including our normal immunization program, unless there is community support, and this is a new program with new virus, so challenges are more.
Identifying, contacting and delivering the vaccine is a massive challenge that state governments will face. That is where help from RWAs becomes crucial.
Delhi government is planning to vaccinate 1 lakh people in a day. So one should hope that the joint efforts by the government and RWAs will make Delhi corona-free city. In New Delhi, with cameraman Kripal Singh, POONAM Sharma for India Today.
Here as well, Professor Sarin, there's a lot of confusion because in some instances, the RWAs have been contacted by local authorities and then they've started drawing up these lists. In some instances, they're drawing up lists by themselves and then nobody's really told them to, and even the criteria isn't clearly defined. How do you ensure that there is clarity around these issues? The people know who's eligible, how will they be eligible, where do they actually need to go, because you've got all these lists being drawn up and yet at this moment at least there isn't adequate clarity of when and how the vaccine will be administered.
Well, phase 1 is for healthcare workers. For Delhi is about, let's say, about 2 lakhs or so, 200,000 people for healthcare workers. So if we are vaccinating, I guess 100,000 in a day, we would be able to finish in 2 to 3 days. The numbers are, if you are vaccinating 100,000, you will require, per center is about 100, so you will require 1,000 centers to be active. So if we are lucky and we get participation in 2 to 3 days in the large hospitals, the healthcare workers could be done. And then the Resident Welfare Association support must be there. They should have their list ready. And I'm sure the government is reaching out to them very soon. So they would be in the second phase. So at least they should do their job and say, look, we have 50 and above, 50 and below with comorbidities, those who are in a high risk category, all those are very well defined and published.